Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen, and we're just getting our first look at this biceps, which has been the source of so much discomfort for you. As we tug on it, it doesn't look as bad as I thought it would, but we certainly know from all our attempts to treat it outside the joint that this is a pain generator for you. So we're going to do the soft tissue tenodesis like we talked about. We can confirm relatively quickly that the articular side of the rotator cuff looks fine, which is what we expected. Rotator cuff's not torn. As we look down the front of the shoulder, we can see the labrum looks intact, looks reasonable. As we pull back a little bit on that anterior cannula, we can see the middle glenohumeral ligament there. We can just see a little bit of the subscapularis tendon crossing up to the left towards 11 o'clock on the screen. And then as we look farther down anteriorly, we can see kind of the inferior recess, and then all the way around the back here. As you look in the back, the posterior capsule inserts normally into the humeral head. I don't see any significant articular cartilage injury on the back of the humeral head. We can look all the way at the top here, and that looks good. We'll come back in here and pass a spinal needle through the biceps, just like that. Hold the camera, please. We'll pass a black wire that we call a super shuttle through the biceps. Right up here. Okay, we'll just pass that wire through a bit. We'll take a grasper. Important to just hold still with the grasper and back the needle out first so we don't damage the relay. And we'll load that relay with a stitch now. And as we pull back, you can see how that brings that suture through the biceps tendon here. So now we're going to take the needle and pass through a second time. That's actually not bad right there. Gives us a lot of hold on the tendon. Pass the wire through a second time. Okay, so we've released the biceps. We have a good hold on it. You can see it there at the top of the screen, and now we're going to be able to tenodese that so it no longer causes any problems inside the joint. I'm going to continue to take a second look around and make sure there's nothing else to worry about. But at this point, everything is looking pretty good. Okay, so we're looking in the subacromial space. We're taking off a little bit of the anterior acromion here. This is the front of the shoulder on the right side of the screen. So we're just going to take off a little bit of this anterior lip here. We've already taken off a little bit laterally. Okay, so we'll push on the clavicle, and there's your AC joint right there. Your clavicle's right under there. We can bring our burr under here, make sure we don't feel any rough edges underneath. We'll work over there a little bit later. But the key here is we've got the front of the acromion, I think, pretty well decompressed. Okay. So lots of room now here between the bone at the top of the screen and the rotator cuff tendon below. This is our anterior cannula right here. So we'll go off on the video for just a minute. Hold the camera, please. Okay, recording. Okay, so here's one of the sutures for the biceps. External rotate as much as you can. Other way. And so we'll see about, you can relax on them now. We'll get this one, and then we'll hold this cannula. And then we'll get the other suture here. Should be right back over here. There it is. Tap it up, straight up first. Okay, we'll get that, show you some more in just a minute. Okay, so what we're showing you here is our cutter. This is what cuts the sutures that we've just tied to secure the biceps tendon. As I rotate the shoulder, you can see there's the suture. So that's securing the biceps. The rotator cuff on this dorsal side is not torn. So now we've confirmed on both the articular and dorsal side that the rotator cuff tendon is intact. There's the posterior view. Okay. And I'm happy with the way that looks. There's our decompression. That's the acromion bone at the top of the screen. So we'll have one more look around here in the subacromial space, but I think we've done everything we set out to do. And I really hope this does the trick for you. Good luck to you now. Bye-bye.